Hi, my name is Henry Ekechi. A lot of professionals passionate about the project they undertake find it complex to monitor and evaluate the process for effective delivery. This includes antimicrobial stewardship programs. Do you know that a project properly monitored and evaluated can minimize funds spent in the lifetime of a project? Today, I'm going to take you through how to effectively monitor and evaluate antimicrobial stewardship programs. When you effectively monitor your AMS programs, you will readily identify the specific challenges around rational use and prescription of antibiotics in order to provide solutions. By the end of this session, you'll be able to carry out these 5 outline steps towards effective monitoring and evaluation of antimicrobial stewardship programs. You're going to be able to define monitoring and evaluation, examine how they differ from one another, describe the purposes of M&E in antimicrobial stewardship program, define the key terms involved, and develop a monitoring and evaluation plan. As preamble, what is AMS? That is antimicrobial stewardship. According to the Society for Healthcare and Epidemiology, antimicrobial stewardship is a set of coordinated strategies to improve the use of antimicrobial medications with the goal of enhancing patient healthcare outcomes, reducing resistance to antibiotics or antimicrobials, and decreasing unnecessary costs, or simply put, the right antibiotic for the right patient at the right time with the right dose and the right route, and cause least harm to patients and future patients. There are 6 core elements that drive antimicrobial stewardship programs in healthcare facility setting. This includes 1. Leadership commitment, accountability and responsibility, antimicrobial stewardship action, education and training, monitoring and surveillance, reporting and feedback. The areas of concentration in this session is core element 5, which is monitoring and surveillance. Meanwhile, there are 7 key steps for establishing a healthcare facility antimicrobial stewardship program. This includes undertaking a facility AMS situations or SWOT analysis, establishing a sustainable AMS governance structure, prioritizing the healthcare facility's core element based on distribution analysis, identifying AMS interventions starting with the low-hanging fruits, developing a healthcare facility AMS action plan, implementing AMS intervention, the last but not the least, monitor and evaluate AMS interventions. I want you to pause and think of what is common among these objects. The objects in one way or the other is used for monitoring. This clearly shows that monitoring is not a strange practice. We are involved in monitoring even as we carry out our daily activities. So, what is monitoring? It is the ongoing routine collection of information about a project's activity in order to measure progress towards results. It helps to determine the activities, identify if activities are implemented as planned, verify products and services delivered, track performance, assess effective resource allocations, make informed decisions, and finally identify aspects that are working in the project. What do you monitor and when do you monitor? We will answer this question taking a close look at monitoring and evaluation towards side-by-side quality assurance. The need of every project in the program context considers the desired vision for venturing into such project, with what we invest into the project considered as inputs, what we do to execute the project considered as activities, goods and services produced from the project are considered as outputs. What happened because of these activities are considered as outcomes and impact. This outcome and impact can be divided into short-term, mid-term, and long-term. What happens because of these activities on the short-term and mid-term is as well regarded as outcome, while that on long-term is considered as impact. Quality assurance can be conducted first by defining and determining what we consider as quality, devising means of measuring the quality and proceeding to improve the quality. Supportive supervision is central in all of the process we are considering. Through supportive supervision, we can achieve the following. 1, monitor performance, recognize good work, be proactive, identify and correct problems, and finally, establish goals together. In a project life, we monitor the following. We monitor inputs, we monitor activities and outputs. It is important to note that monitoring happens while the process is ongoing. It's good to note that quality assurance goes hand in hand with monitoring and evaluation to identify standards, assess current practice, compare with standard or guideline, change practice to meet standards, and perform audit and feedback. It is worth mentioning again that quality assurance is greatly impacted by the level of supportive supervision deployed in a project. So we are done with monitoring. Let's talk about evaluation. Evaluation is referred to as the measurement of how well program activities have met expected objectives, extent to which new changes can be attributed to the program. So what is the importance of evaluation? Evaluation makes us to understand why activities have been implemented, explains whether project has effects, determines extent changes can be attributed to the intervention we profile, describe whether intervention had unintended consequences. Evaluation is carried out by doing the following: measuring indicators, relevant stakeholders involved in indicator development, analysis, and feedback. Evaluation targets outcome and impact in the life of a project. This tries to understand if the outcome and impact of a project have been achieved. Monitoring and evaluation of antimicrobial stewardship program involves some critical steps and must include the following. 1, plan. This involves development of data tools which captures all monitoring and evaluation activities for the AMS program. 2, purpose. It is tracking progress towards project goals and determining whether desired results are achieved. 3, it has to promote informed, evidence-based decision making. 4, it has to contribute to organizational learning by informing the AMS team of the effect of the AMS initiative. 5, it has to help AMS programs satisfy reporting requirements and facilitate dissemination of findings, providing feedback to prescribers. So what do we consider as tools? Why do we consider monitoring as tools for surveillance in antimicrobial use? This is because monitoring trends within a hospital over time and identifying small changes in a single ward are essential in identifying antimicrobial use, identifying wards with high antimicrobial usage or use of non-policy, defining targeted interventions required, adapting empiric treatment according to local resistant trends, demonstrating changes in practice over time. Let's consider the monitoring components one after the other. The first on the list is input. Remember, as we talked about before, there are various aspects in the project lifetime which is monitored. Input is one of them. So input are resources required to complete project activities. They can include, for example, things like human resources. It involves partners, skills, knowledge, experience. It can also involve money, equipment, or time. The second component is activities. Activities, also referred to as processes, are project activities or initiatives. Project activities utilizes the input components. Take, for instance, holding workshop for training new public health nurses. That could be regarded as activities. The third component is output. Outputs are the immediate measurable results of project activities. Examples can be increase in awareness in a training activity. The fourth component is outcome. Outcome is short-term, intermediate, and or long-term effect of the program. This informs the degree to which AMS intervention has reduced AMR, that's antimicrobial resistance, other unintended consequences of antibiotic use. Examples can include percentage change in antibiotic resistance, percentage change in drug costs, percentage change in mortality, or it can also look at something like percentage adverse drug events. In monitoring and evaluation of antimicrobial stewardship programs, it is necessary to consider developing a framework. This framework should include: 1. What will be measured? 2. How data will be collected and recorded? 3. Analysis and interpretation of the data. 4. Feedback of the result to all stakeholders. And finally, acting on the results. Thank you.